We are at the ultrasound workshop with Fujifilm. Here I have Cassandra, which is an application specialist, and she's going to talk a bit about their ultrasound machine.
Okay, so this is actually our new 750, Arietta 750 DIX system. So I'll just give you a quick overview of the machine. So we've actually got a thinner, wider screen on our new modules, and it's a high contrast screen. It's about 23.8 inches compared to our previous one of 22 inches. You've got a 10.4-inch touchscreen, 4 active probe ports, and 2 parking ports. So DI actually stands for DeepInsight. So what exactly is DeepInsight? DeepInsight uses an AI technology to enhance image quality. And it does this by extracting only necessary information from a vast amount of data, meaning fine and complex tissues that will otherwise be marked by noise are easier to visualize. So the images you obtain have an improved signal-to-noise ratio. This system has something also called e-focusing. And e-focusing basically acquires multiple receiving beams from a single transmission, combines this to create a single image in real time. And Fujifilm have actually developed this technology further by incorporating what we call e-focusing plus. So this uses multiple frequencies at varying depths of the image to give you a homogeneous image in the near and far field. So the image is focused at all steps. It's also called something called carbon imaging. So carbon imaging just makes sure that the tissue boundaries are clearer and sharper. So when you're scanning the liver, especially the posterior part of the liver by the diaphragm, you get a sharper image. I also want to highlight other technologies that we've had with this new system release. So I'm going to quickly talk about the new quantitative measurement tools that we have for our system for liver assessment. So we've got the standard IATT, which is attenuation coefficient. And we've also, Fujifilm have actually brought about a new measurement tool called SBSI. So SBSI actually stands for Statosis Backscatter Index. And Statosis Backscatter Index basically uses the backscatter from fatty liver tissue. So we all know that fatty liver or fatty infiltrated liver changes how ultrasound echoes are reflected back to the transducer. So what our system actually does is that it uses this information to give you an additional tool to assess fatty content in liver, which is really quite good. I just want to highlight some of the Doppler options that we have on our system. So we have the conventional color flow Doppler, which shows you directional flow of blood. We've also got power Doppler, which also shows you perfusion of blood in a tissue. However, on our system, you can actually put directional flow on as well, so it can show you directional flow with power Doppler. We've also got something called DFI, which stands for detective flow imaging. This is also quite good for microvasculature, so tiny vessels. It shows you flow in those tiny vessels. And lastly, we've got something called eFlow. And eFlow is also quite a sensitive color Doppler option that you can use for tiny vessels, so also for microvasculature. So there's been an improvement to our fusion imaging on our system. So with real-time virtual sonography, there's been an improvement on that. And lastly, I want to highlight our new probe that we have. This is actually a high-frequency hockey stick probe. It's the L52H. It ranges from 3 to 25 megahertz. So you get really good resolution for MSK scanning. And this is the probe we're actually using quite a lot in these sessions for all our MSK stuff.
Thank you for the overview. Thank you. Very nice to meet you, Cassandra. Thank you.